All right, after that other segment, I'm inspired to lose every little bump.
Look at Sarah Rose, yes.
Anyway, we're not fooling around here. We have Dr. Robert Anolik here, and we have
CoolSculpting, too.
CoolSculpting.
Right.
So it's the latest thing people are doing to get rid of areas that just will not go away no matter how much you exercise or diet, right?
That's the ideal patient. Yes, if there's a little bulge that's resistant to diet and exercise, it's the perfect area to treat.
But you could also tell someone, nah, you probably need the lipo versus this, right? I mean,
we had that conversation, and actually I view it as part of the big picture, as a motivator to live a healthy lifestyle, diet, exercise, and use this to get even further than you can on your own.
All right, let's see how it works.
Okay.
Do you mind that kind of, taking us through every step?
Of course. So she's an ideal candidate.
By the
Felicia.
way, thank you so much for showing us.
Thanks, Felicia. So why is Felicia an ideal candidate?
Goodbye, Felicia. Goodbye, fat.
Goodbye, fat, yes.
Goodbye, fat.
She's very slim, she's in shape, and there's a little bit of bulge on the lower stomach that almost all of us have.
We have it because we've given birth to children.
Exactly.
We are miracle people.
You are, but men have this too. So it tends to be genetic, and it shows up here.
What percentage of your clients are men?
This is really a 50-50 thing.
Wow.
I have so many men who come in.
Okay.
Once we clean off the area, we apply a gel pad, which protects the skin from the cold temperature. So we'll take this gel pad off here. And this goes right on the area that we're going to treat.
Does she have to do anything before she comes here? Like, does she have to fast? Do you have to do, do you have to go on a diet before you come here?
It's a great question. There's no prep required by the patient. They can just come in and have the procedure done. And amazingly, there's no restrictions after the procedure either.
So you can have like a bagel before you come in.
Have a bagel, enjoy yourself. People can have a bagel during the treatment.
So how long does the treatment typically last, the first one?
So we apply the applicator to the area that we're treating, anywhere between 35 to 45 minutes typically.
Is it one size fits all of this?
Well, we're able to customize based on size and grip, and for her, she has a very typical lower stomach that we're going to be using a typical applicator to treat.
Okay.
So we can apply it if you'd like right now.
Yeah.
Go ahead.
Okay. Are you sure you're okay?
I'm ready.
You ready? Okay.
Is that super cold right now or no?
Not yet.
Not yet.
Okay.
But this will be applied, and she might feel some temperature change. Here we go, Felicia. On the count of 3. 1, 2, 3. And it grabbed on fairly firmly. How do you feel?
I feel great.
Do you feel anything?
It feels like a little tingly, like a massage, kind of a little. But it doesn't hurt at all.
It doesn't feel like pins and needles or anything?
No, it's kind of relaxing, actually.
Really? Do people go to sleep while they're having this treatment sometimes?
I've had many patients nap, snack, use their iPhone, watch your show.
I like that part. So, Doc, okay, I mean, really, if you're going to do something like this, you really want to get the most from your investment because it's not cheap, right? How much is it?
It depends on what you're doing, but it could be a few $100s to a few $1,000s based on how many areas you're treating.
Right, so you want to diet and exercise when you do something like this?
I just view it as part of the big picture, and it works quite well to combine it.
How many areas can you do in the course of one treatment?
Sure. So we do this procedure quite a bit in our office. We've done early clinical trials to help with the concept and development of it, and it was developed by dermatologists up at a lab at Harvard. We have treated multiple areas in a visit, and we have multiple machines, so we're able to treat multiple areas at the same time, which tends to be very efficient.
So, Doc, you just leave that thing there for how long?
We would leave this here for the next 35 minutes and see how she does. We would then remove it and then apply it to another area if we wanted to.
And you would actually stand there holding it, or do you hand this off to...
We're able to stabilize it in place so she's comfortable, and then we can talk to other patients and see how they're doing, and then come on back to her and make sure she's still doing well.
Or something.
Exactly.
And would we see anything after 30 minutes? Like, you would see some kind of a change?
You wouldn't see a change right away. The skin could be a little bit pink. Uncommonly, there's a little bit of a bruise just because it's holding on with a vacuum seal, almost like a hickey. But it's more common to have a little pinkness on the skin.
Remember those days?
I do. Turtlenecks, yes.
You can really start to see the improvements by about 3 weeks out. And I think you see a fairly dramatic change by about 2 months, but it can continue out to about 4 or 6 months to see continuing improvement.
And does it last?
It lasts. It's very long lasting because the cells that hold the fat are metabolized and processed, and they go away.
So you say they go away. So does that mean you urinate them out? I mean, where do they go?
So our body is constantly storing fat and breaking down the fat and using it as energy. So our body is not challenged by the release of the fat that's sitting in the cells. We metabolize it, use it as energy, and that's it.
That's it?
Yeah.
Oh, I was just wondering if you were going to spending more time in the bathroom.
No.
Okay, good.
I've also heard of the other method of, as opposed to the CoolSculpting, but using heat instead. So what's the difference, and why does this work better, worse, whatever?
Yeah, so there are several strategies for it. We find that this is the gold standard and most effective, but we're always open to every methodology, and we have a large clinical trial unit in our practice, and we study these things. There are laser devices, ultrasound devices, radio frequency devices. This uses temperature on the cool side. And all of these things are fascinating, and it's an early part of the evolution where we're going to see more and more improvement over the years.
So compared to liposuction, what has better results?
Liposuction will get a much more dramatic result, but you're undergoing surgery. There's a lot of anesthesia. There are large, essentially needles that we call cannulas that go in the body to pull out fat, and there's much more downtime. With this, you can have the procedure done at lunch, go back to work, no restrictions whatsoever. I would expect with the treatment to see a result. I think that if you do it a few times, you optimize that result, and whatever you can squeeze, you can see an improvement, and I would expect about 20 to 30% of the fat that you can squeeze would really reduce and go away.
So really with one treatment, you're really denying yourself the full benefit by getting a couple extra, right? I mean, nothing's going to happen in 30 minutes really long term.
I think in long term you will have a benefit, but you can make it even better by doing it a few more times. And frankly, it's such a popular procedure in this window of time because summer's coming and people love it right before the beach.
Right.
Felicia, how you doing?
Okay, I'm doing great. I can't wait to get a new bathing suit.
Good for you. Hey, Doc, thank you. Where can we find you, by the way?
So you can find us online, of course, on our webpage, laserskinsurgery.com, or on social media as well. Instagram, I'm Dr. Robert Anolik.
And you do everything,
Fantastic.
right?
I do everything. So all my patients are treated by me.
Okay.
All
Beautiful.
right. Wonderful. Thanks. This has
Thanks
been
so
fun
much.
to watch. Yeah.
Felicia.
Goodbye.